Welcome to the Unchill Podcast. I have two very special guests with me. Today I have Dr. Mohini and Dr. Jaya Deptar. Dr. Mohini is an associate professor of psychiatry at Yale School of Medicine and staff psychiatrist at VA Connecticut. Her clinical work is in outpatient MH care, including interventional psychiatry treatments. She is a principal investigator of YSM study designed to understand altitudes, awareness, and gaps in understanding and the resources for MH treatments among South Asian Americans. Thank you so much for being here.
Thanks for having me.
We also had Dr. Jaya Deptar, who is an internationally renowned Ayurvedic doctor and licensed esthetician who serves as a chief compliance officer for a healthcare company in Connecticut. She's also an accomplished author and teaches wellness on a global scale. Thank you for being here.
Thank you for having me.
So today is going to be all about mental health from both of your perspectives. So what does good mental health actually mean?
I think that's such a great question because it's easy to ignore good mental health and focus only on mental illness. And I think good mental health is a spectrum, just like good physical health is on a spectrum. And what good mental health means to me is that one is comfortable in how one is feeling, one's thoughts, one's attitudes, one's ability to engage with other people, make friends and relationships, and feel a sense of satisfaction and happiness. And all of that put together would be good mental health.
What about you? Do you have
I mean, she said it well, very, very well explained by her. I would add a couple of things in it because Ayurveda works a little bit differently. So it is all about body, mind, and soul harmoniously in balanced condition. So when you ask about mind, it's not just a mind; it's a body and mind. And when you're doing well with your body and with your thoughts and what with your behaviors, that's a good mental health.
lovely? Many people believe I have a great life, so I shouldn't feel sad. How do you explain that mental health isn't always about circumstances?
Yeah, it's such a fallacy to think that things are going well, my job is going well, my family is doing well, so cannot be sad. There's nothing to worry about. And we don't question this about physical health. You don't you know that there are many factors that going into your physical health, and it's really the same with mental health. There are genes, there is previous experiences that are lifelong, and then there are current circumstances. And all of them go together, the biological, the psychological, and the social factors. So having good mental health or not having good mental health is a coming together of all of these factors. So you can definitely have problems with mental health, even if circumstances are good, or you can, be an individual who is going through really difficult circumstances and have good mental health.
So I would like to say a little bit different way. What happens is when you are not in a balanced condition mentally in Ayurvedic way, then you are not well in your body as well. Like you have some type of gut health condition, some type of illness going on in your body, and vice versa. So what happens is if you're not eating well, let's say, or you're getting angry, or you so that means something is going on inside the body as well. You have pain somewhere. Your digestive system is not going well. That means you have acid reflux. That's a simple example I'm giving. So it reflects both ways. So issues in your body, it reflects in your mind, and issues in your mind. If sometimes people get so angry, agitated, and depressed and all that, but that means there is something not in balance in their body as well.
Can I add to that? I think that is really, really important because it's easy to recognize physical problems. And so using that as an example, pain is a really good example.
Really good example.
So when someone has pain, especially chronic pain, not just woke up today with pain, but you have chronic pain, it could be migraines, it could be headaches, knee, joint pain, back pain, whatever it might be. And over time, it starts taking a toll on your mood, your sleep, your anxiety, your general sense of wellness. Now you don't go out so much because of the pain in your back. So you're not socializing anymore. So you're losing your social support. Maybe you're not eating so well because the pain medicines are upsetting your stomach.
Right.
So now that is having an effect on your overall mental health. And so over time, this just becomes cyclical. And so the mind body relationship is really bi directional and cannot be underemphasized. So thank you for saying that.
Right. And I will also add one more thing to it. It's a good discussion. Sleep is the biggest thing. It's a big factor in any issues in your mind and your body as well. So good sleep hygiene is very important.
Great.
What are some everyday signs of anxiety, depression, and burnout that often go unnoticed or misinterpreted?
Yeah, they're really, again, along a spectrum. So I'll start with depression just because that's is maybe more straightforward. Many terms in psychiatry or mental health are common words in English, so we mix them up. My little kid could say, "Today I'm really depressed because my soccer game didn't go well," but he doesn't have symptoms of major depression, which is what we consider the illness. And so, similarly, the symptoms are also along a spectrum. So, feeling a little sad doesn't equal having problems with your mental health, but that doesn't mean one should ignore the symptoms either. So, common symptoms include changes in mood, and a change is really an important thing to pay attention to. And sometimes it happens slowly, so not to ignore that. But for depression, things like loss of interest, just not feeling so connected with things that you enjoy. I love reading books. So for me, I think that will be one of the biggest symptoms. If I ever notice that I have no more interest in reading books, that's a huge change for me. So paying attention to things that you have lost interest in, no desire to feel connected with people or things that gave you joy previously, or even if you force yourself to do them, you don't enjoy it anymore. Ruminating, thinking about the same thing over and over again. I mean, all of us ruminate to some degree, but when it starts interfering with your ability to just do other things in your life or have fun, or, and this is, I think, really important, we never ruminate about happy things. No one sits around thinking about all the wonderful things happening in life, right? So when we start that cycle of rumination around either negative things or worrisome things, and as it gets worse, things like not being able to concentrate, not being able to function at work, for higher functioning people, people who have jobs, careers, taking care of family, friends, etc., um, people pull themselves together. So they pull all their resources, function well there, and then come home and they can't do anything else at home. That's an important sign to pay attention to, because to the world outside, you might not at all look like anything is wrong, but that's just because you've pulled everything together and you're collapsing at home. In terms of anxiety disorders, again, it can present with all of these symptoms. Anxiety and mood disorders are so highly comorbid, and I'm talking about depression, but of course, there's bipolar disorder and other disorders as well. Um, and if your symptoms are a big change, starting to interfere with how you're feeling or how you're functioning, even if people outside cannot notice it, I think that's a big signal. Everyone Googles everything nowadays. But the Mayo Clinic, Cleveland Clinic have really lovely patient resources. So just checking those out and seeing where things are falling and reaching out and talking to someone.
Yes, and also, like she said, like her son said, "Oh, I'm really depressed." So people read Google search and they think that they have some type of symptoms, which is not true. But when it becomes like chronic habits, or when someone notices like, okay, change in mood is like happening for weeks now and it is not changing, that means those imbalances are in body and not getting worse,
That's right.
but then not getting better. And slowly when it starts affecting your body as well, like because of your depression or anger or whatever it may be, behavioral symptom change, or the habits change, and then you feel like, oh, I'm not hungry, or someone is not eating well, and that's a good sign, like this person who who is a good eater and foodie, and that person is not eating well, or not paying attention to his food. Um, so that is the sign right there.
Yeah.
People often wait until things are falling apart to seek help. What are benefits of reaching out earlier?
Yeah. I mean, this is a life lesson for all of us, right? We never should wait till you need surgery to go to the surgeon. And you shouldn't wait till things have totally fallen apart. Prevention is always better than cure. So I'm not even going to talk about when to seek psychiatric health. I actually think we don't spend enough time about developing healthy habits that can actually improve mental wellness. So forget mental illness. I think I'm one stage before that right now. Jaya just mentioned sleep. I mean, good sleep habits is probably the top, healthful thing we can invest in. Exercise, I'm terrible at it, but it's so critical to overall feeling of wellness. And some sort of social engagement. Lots of studies have come out now that the biggest predictor of lifelong wellness and happiness is social connectedness. That does not mean you need 100 friends. It just depends on what you identify as social connectedness. So if you're a person who really has one good friend and that's a lovely relationship, that's a solid social support for you, that's fine, that's awesome. Or if you're, an extrovert and it's going to be 50 friends that makes it feel right for you, that's fine. But having that social connectedness in multiple domains. So really investing in habits for good mental health. And then being aware. We don't talk about this often enough. And so it's only when things start falling through the cracks that even you pay attention or others pay attention. So just being observant to your own self, just like we should be observant to our bodies, we should be observant to our minds.
Yeah. So it's the same thing, like in ancient science, like Ayurveda or Vedic science. It's always said that prevention is better than cure. So don't go there. The first thing is first, like take care of yourself. So self-care is a big thing that people are ignoring nowadays. And the lifestyle management. Lifestyle management is a whole science. It's not just people think that, oh, what she's going to say, just, wake up in early, do this, that. No, it is all about um, the lifestyle management according to your body type. So, what is going on your body? According to that, if you take care of your lifestyle, what needs to be done, then it's like, I'm not saying that you 100% prevent it, but it's a better prevention.
How do attention-related issues like ADHD show up in adults, and why are they often overlooked or misunderstood?
Yeah, it's probably complicated for this generation because for my generation, maybe not for the young adults now, because it wasn't recognized so much when we were kids, right? And so it's a combination of factors. There is people who maybe always had some attentional problems throughout their childhood, youth, etc., and it just wasn't recognized. And now it's becoming a little recognizable. That's one pattern. The second is that people are developing some attentional problems as adults. And there might be multiple reasons for that. One might be that when the total load, the total burden on that person's mind, the number of things they have to keep track of is fairly reasonable. They can cope with it. The attentional problems, the deficits are not becoming that evident. But say as you're growing older and the number of your responsibilities at work and home, everything is growing, and now you have to keep a lot of things on track, and suddenly you start noticing the attentional problem. So it's really could be a combination of both. And I do think that people who are being recognized as adults, to some degree, either they have coping strategies that they have been able to lean back on, or that as they're growing older, they're actually developing other causes of attentional problems that are making this evident. So things that happen is you miss deadlines, you kind of forget certain things, you start realizing you got to write everything down, otherwise you're going to forget about it. We have lovely tools nowadays that help us stay organized, but at the same time can mask some of these. And so what people will start noticing is interpersonal problems. So no one says, "Gosh, I'm having problems with attention." They're like, "Oh, you didn't remind me of such and such thing." Or, you forgot to do whatever the task is. And so it leads to some friction, maybe some irritability, and that's kind of how maybe it'll come to attention.
Yeah. So yes, I mean she said it well. But what I would say that in the kids, it's very noticeable sometimes. Like they just don't pay attention, or they're very much demanding in one thing. And what parents do, instead of recognizing that, they actually provide them whatever they need or how they're comfortable with. And instead of discipline, because discipline is very important and that's a part of the lifestyle. And if we don't give, and then they fail to focus on something like waking up in the morning. Let's say 6 o'clock class they have to go, and then they don't wake up, and then they're late. It's like um, parents sometimes they pamper a lot. Like, oh, okay, that's okay. 5 minutes, then 10 minutes, then 15 minutes. So when you see the first sign or the second sign of it, actually the parent should pay attention to that, that this is something different which is not right. Focusing also the same thing, like if the student or a child, if that person is not paying attention to their studies and failing with their marks, and you're seeing the degradation of their points, then right there, this is the sign where parents should understand that something is wrong.
Definitely not ignoring. And
Not ignoring.
there are so many ways to help, right? So there are support, there's redirection, there's organization, and then there's evaluation, there's other therapies, and then there's medication. So there are so many ways to help.
So many ways to
really
help.
recognizing is the first step.
Mental health changes across the lifespan. What should people be aware of at different stages of their life?
Yeah. Firstly, I'll just start by saying most mental health problems can emerge at any time. There are certain peak times that some do emerge. So, and the psychiatrists or therapists are well aware of that, and will keep an eye out for that. Primary care doctors, etc. But even we can do that. We can do a good job with paying attention. We know that changes in hormonal stages, puberty, menopause, these are really times for emerging mood patterns. Does that mean it's an illness? Not necessarily. It might just be normal and might settle down into a sort of balance. But it's important to keep an eye on that and not ignore it. In addition, older age, as we grow older, we are at greater risk for again emerging depression and anxiety, especially women. So postmenopausal period for women is a period of increased vulnerability. For women, also peripartum periods are periods of increased vulnerability. So when they are pregnant or when they've just had a baby, that's a time of increased vulnerability. So I think OBGYN officers routinely ask these questions when we go to them for checkups. So they're really trained in that. And then, memory problems. It's something, again, we don't talk about until it leads to problems. But when as we go to primary care doctors, as we're growing older, they'll keep an eye on it. And they'll keep asking us questions about it and kind of assessing for that. So really embracing that there is going to be change as we grow older. I'm going to get arthritis as I grow older, and I'm going to have some other problems with my memory as I grow older. And so really being mindful of that to try to pay attention to it.
Is there any way to prevent these things?
So absolutely, the short answer is going to be yes and no, which means we can do many things to help slow down emergence or limit the emergence of illnesses. And on the other hand, for depending on each individual, because we're all we are a combination of our genetic vulnerability, biological factors, and stuff that happens to us over the course of our life. So for some people, it's going to be treatment that's important. We know that maintaining good, healthful habits is always going to be a benefit. So, paying attention to diet and nutrition, exercise is just amazing. Getting healthy sleep. A lack of sleep is such a big problem. Undiagnosed sleep apnea probably plays a big role in so much of our mood problems and memory problems nowadays. And then, even after someone recognizes that we have this deficit, whether it's in mood, anxiety, or memory, and maybe one needs to go on medications or therapy, but building up these lifestyle changes is going to be critical because they're going to keep supporting us. I really, in my clinic, I always break it down to kind of draw the similarity with physical problems because we recognize that really quickly. So if I fracture my leg, of course I need a cast and bandage and whatever to immobilize the leg short term. But then I'm going to need physical therapy and rehab. I'm going to have to take the calcium supplements and really build up the strength over time. And it's really the same with mental health. No matter what happens, you need that short term, whatever the treatment might be, or maybe it's long term. But at the same time, you have to do these healthy things to try to prevent further worsening or further emergence of problems.
So, yes, and that's everything I agree with her. Um, so, you asked the question about prevention. So, prevention, like I said, it's not 100% cure, but self care and lifestyle management, stress release, rejuvenation, these things are very important. Not time to time basis, like when this happens, like hormonal changes are happening, the stages of life, but overall in day to day life, because we are in rat race and everybody is, and we're stressed. And sometimes it is underlying stress that you don't recognize it is stress, but there is a stress. So those things are really needed. 30 minutes exercise every day. That that releases some stress. You need some yoga, some kind of meditation, some kind of breathing exercises. That has to be daily routine. It's not like when it comes to the stress and when someone recommends or
Right.
therapist recommends to do that and then you start. That's not prevention. It's from the get go. You need those develop these habits from the childhood. Then it becomes the routine when you become adult, and those stages from your childhood to
Yeah.
adulthood, and then when you gets someone gets older. Another thing I would like to add, besides the hormonal changes and stages of your life, there are emotional stages, emotional shock. And that happens with the clients. They go in sudden depression or the stage of depression. And I have seen that a lot. Trauma, old memories, um, emotional trauma and emotional stress I have seen a lot, and it becomes shock. Like you have, let's say, just an example, you have a relationship with someone very close, you're in very close relationship, and one day it breaks, and that's where the mind breaks. And I have seen that a lot. So those steps are really important when you are involved in something. That's where meditation comes in. That to prevent that too much involvement. That teaches you that it's okay if one day that happens. It's okay, and that everybody needs to learn that.
I think you said it really beautifully because one of the things we don't talk enough about is building resilience,
Exactly.
right?
Yes.
And you can't do that at the last minute. You have to do it ahead of time. And just in case anyone listening is thinking, the I am a terrible example of practicing what I preach, right? And so now I'm inspired. I feel like okay, it's not never too late. At
It's
any
never too
stage
late.
of life, you
Any
can
stage.
start from scratch and start building those building blocks of resilience.
This is more of a personal question, but when I'm on my period, we're all women here, I usually don't follow these habits, right? The exercise goes out the door, the eating habits go out. What would you recommend for women who struggle with that?
Yeah, the short answer really is keep it up. like keep up the good habits, but also be kind to yourself, right? Like when if you are following a healthy routine for 30 days in the month and you don't for 5 days, you're okay. So you can forgive yourself that time. But if you can find a way to replace maybe intense exercise with something else that is more calming or more comfortable during the period, that's fine. I don't know if you had other suggestions.
Yes, so like I said, yoga, meditation, there are certain types of yoga just for those days that calms you down. And stress release is very important at that time because it's the time where the hormonal changes happen. And when you make that your routine, then the next time you feel like, you know what, I'm getting better than last time. Food really matters. The diet and nutrition, according to your body type, and especially that time frame when the hormonal level is really high, then soothing diet helps. So there are certain things to follow, but definitely, like I said, it's not 100%, but yes, you can do 70%, 75% better if you follow.
What about mood swings? I don't know if you
Yeah.
guys, mood swings during that time
Yeah.
period. How can we kind of regulate it?
Yeah. So, I mean, there is kind of, I'm going to say again, spectrum. I feel like I've used the word spectrum so much today, but it's really a longer spectrum. It might be just within the normal range of small mood fluctuations that can happen mid-cycle, that can happen just before the period starts, and can last throughout the period, and even a little more. And then it could be so extreme or so noticeable that it really kind of meets a disorder, and that means that which is highly treatable with, amongst other things, medications, which can be taken just during the timing of the period. So recognition is the first step. So I would say the first thing I would do is chart it. So if you're using an app or you're using a calendar, like some of us, just a check or an X just to see what's happening. And then over 2 or 3 cycles, you'll know, is it just that you happen to notice this cycle that something is off, or is it actually happening every cycle? And if you're noticing a pattern to your mood, whether it's around periods, whether it's, we're in Connecticut, seasonal affective disorder is a huge problem in the fall and winter. So if you notice a pattern, identifying it, talking to your doctor, lifestyle changes, certainly other non-medication options, but medications work beautifully for regulating mood during if you have perimenstrual dysphoric disorder.
So, what I suggest to my clients in those cases, you need to develop some kind of hobbies, and those hobbies really help, such as singing, playing an instrument, because those are the vibrations, and those vibrations help our mind to calm down or the moods to calm down. And I think everybody who is listening should try this. Those vibrations can be, if you are not a singer, doesn't matter. You can just make humming sound. You just make om sound. Whatever sound you're comfortable with, make that sound, and just experience those vibrations. How these vibrations um, helping you, and like she said, make a chart. And seasonal mood swings are also there. It is a thing, and it's said in Ayurveda also. You will feel differently in summer versus winter versus fall. So, and if those are about the vibrations, right? But if you know how to play guitar, let's say, those vibrations help too. If you're an artist, on those days, just decide that I'm going to complete few paintings those 5 days, and find out if that helps. And it helped my clients a lot. And these things are very simple. It doesn't need money. It just needs your time and commitment.
Yeah.
That's really good. If someone's never seen mental health in their family, they might think that's not something I have to worry about. How would you respond to that?
Yeah. So, when mental health problems run in families. By the way, every single family, we have mental health problems. That doesn't mean that we have people with diagnoses of depression or bipolar disorder or anxiety disorder, schizophrenia or dementias. But all of us are human beings. We are going to have swings in mood and anxiety. We're going to have periods of positivity, negativity. We're going to have coping styles, and some of it is learned behavior, some of it is genetic, right? I mean, the older I grow, I know I'm becoming my mom. My kids are going to become me at some point because it's the biology and the environment coming together. Plus, our life experiences within one family, each person's life experience is different. Twins in utero can have different trajectories because of different genetic bases, and monozygotic twins, so twins who have identical genotypes, can have different trajectories based on environmental experiences. So, having a history of mental illness, especially if it's diagnosed and one knows about it, is really important then, because you want to pay attention to it so that you buff up all those environmental factors, build up resilience, learn the scoping strategies so that you can overcome maybe some of those risk factors. If your cholesterol is high, really start exercising well so you can keep that cardiac health better. Everyone should exercise, but if you have risk factors, you pay attention to it more. And kind of having a family history of mental illness is kind of the same. But family history plays a very small role in that overall risk of developing mental illness. His experience of trauma, so hormonal changes, all of these factors play a role as well. So, not having a family of mental illness is no reason to believe that one is completely immune from developing mental illness.
Yeah, I mean, it's the same thing in Ayurvedic science also. Um, you call genes, but we call doshic imbalance. So it comes by birth, right? So if mother and father have vata type of genes, I would say, vata dosha imbalance by birth, the child likely to get that. So the same thing with the mental illness also. It's not like it will not come into the next generation. Yes, it will. But once you know the body type, from birth or later, then you know how to cope with it. So how to calm that down, how to change your diet accordingly, diet and nutrition and habits and lifestyle.
I mean, I'll tell you just an interesting thing that we don't know the basis of. If someone in your family has responded well to a certain medication, you have a good chance of responding to that medication. We don't really understand that, but it has something to do with
Something to
whatever
do
the
with,
genetic risk is. And
Yes.
so it's not all bad, it's good to pay attention to what's happening in your family so that you can bring it to your clinicians.
Yeah, it's amazing. What's the difference between therapists, psychiatrists, and psychologists, and how can someone figure out who they should go to?
Yeah. Always a source of confusion. So I'll start with a psychiatrist. That's what I am. That's someone who went to medical school and then trained in psychiatry. And psychiatrists provide psychotherapy, which is talk therapy, and psychiatrists can prescribe medications. Psychologists went to grad school, got a PhD degree in psychology, and usually provides therapy or testing and all of that, but is not does not prescribe medication. So they did not go to med school. And a therapist could be either of these. Could be a psychiatrist, could be a psychologist, could be a licensed clinical social worker. So it's an individual who's trained in some form of psychotherapy. The choice of who to go to is you do not go wrong with going to anybody. You start wherever, whatever is the easiest way to get it connected to treatment is the best place to start. And sometimes that's the last place you need to be, and sometimes that's not. So you say you go to a psychologist and they are treating you and they go, I think you might benefit from your consultation with a psychiatrist. They'll usually have someone they can refer you to or you can get connected. But the best place to go would be like the first place that you can connect. And sometimes that fit is not perfect. That's okay. You try it. If that doesn't work, you try again till you find a good fit.
So, what I would suggest, definitely, you go to psychologist or psychiatrist or even APRN, who is trained uh, psychiatry
Mm-hmm.
and also can prescribe. But in integration, I always suggest to go to a healing practitioner because those things help making the stress down. Um, the other healing therapies help your mind calm
Mm-hmm.
down. So, with integration, I always say that these things are important.
Yeah. And I would just add primary care. I mean, most of us see primary care much more than we see anybody else or GYN. And that's a perfect place to start. Actually, most primary care providers, whether that's a MD or APRN or PA, they really see much more mental illness, which is not reached a level that has to go to a psychiatrist. And people are really comfortable talking to primary care because there's still this fear about talking to a psychiatrist and the stigma around it, and frankly difficulty accessing, right? Like psychiatrists are not that common as primary care, so that's a perfect place to start as well.
What advice do you have for someone who wants support but feels ashamed?
Yeah, I wish I had a magic wand and get rid of that because it's a huge problem. It's unbelievable just how much of a problem stigma, what a role stigma plays in shaping the choices we make. I and especially, and unfortunately it's not something that is removed with education. I think just the number of degrees don't change the stigma. So I think that recognizing for yourself is probably an amazing place to start. If you have a trusted colleague, trusted friend, uh, that's a wonderful resource. uh, Primary care, I cannot say enough about primary care because they are bound by HIPAA, so they're not talking to anybody else, right? But at the same time, they can find resources for you, help validate, say, okay, I see you're going through this, but we can manage this, or say, I think you need something extra, but really help you guide you through that. And sometimes they'll just talk through the symptoms. They're not diagnosing you necessarily at the first time. They can, but they don't need to, right? And they can help. I think sometimes we choose, it's like 0 to 100. They're like, oh my gosh, should I go to a psychiatrist or not at all? But really, starting somewhere is best, but really working through it. I'll just add that I think all of us, everybody in the community, whoever can, should do whatever they can to get to address stigma, and having conversations is the first place to start.
I would suggest the same thing. Primary care is the first place where people should go. And another thing is, um, if your insurance covers, go do the physical every year, and that
Yes.
covers
Yes.
because they ask those questions.
Yeah.
Um, go to your GYN doctor, your regular checkups. Um, it's important to do because that's where it comes up,
Yeah.
and
Yeah.
and it's the right way to do. Um, Another thing about the stigma, and I have seen it a lot, the families ignore that too. The kids ignore. Sometimes it's like they don't know what's happening, but it's good to have that conversation with the parents. It's good to have that conversation with your friend who you trust. It's good to have that conversation with your doctor if are able to talk to your doctor. But don't ignore it.
Yeah. I mean, it's a quality of life issue, really.
Yes.
So if you're not feeling good, you got to do something to feel better. Because we have only one life. You got to live the best life you possibly can. Normalizing words, saying it's okay. I'm feeling anxious. This is what I'm feeling. I'm feeling sad. This is what I'm feeling. I'll just put a plug in, especially for the South Asian population. We've it's there's so much silence around it, and lots of people are trying to break that, but we have so much silence around mental health, mental illness, and
And regular checkups.
regular checkups. So I have an ongoing it's an anonymous survey. So I have an ongoing survey that is really just asking people how their attitudes and how they approach physical problems, physical health problems, and mental health problems. And the gap between the two is startling. And the most common suggestions, I asked for suggestions, what would help improve this? The most common suggestions, so we need to have more conversations, we need to hear more about this. We would love to hear more at the doctor's office, but we want to hear more about it in the community. Online sources, so podcasts, websites, it's really sources of more conversations.
Do you have any last words for how we can bring on this conversation so people don't feel so intimidated by it?
I think breaking down into little chunks is easiest. Everybody is afraid, right? Like, oh my gosh, do I have another illness? And mental health has kind of been shrouded in mystery for long and stigmatized, not just by everybody else, also by professionals. So it's no surprise that there is so much silence around it. So I think breaking it down into small symptoms is helpful and naming it. If you're feeling really sad, then thinking, what does that mean? I'm feeling tearful. I'm not able to sleep at night. The same thought is going through my head 5 times. I feel life is not worth living. So really, as we start naming it, it breaks down that mystery a little bit. And we realize, just as an example, I might say, well, I'm feeling really sad and blah for the last few days. And Jaya might say, well, I'm not feeling sad, but my sleep has been out of whack. And so we can start kind of building that conversation from the bottom up. Instead of saying, do I have major depression? And that's kind of that's not a way to start a conversation. But even with a friend, it's sometimes hard, but you can start with these small symptoms.
Right. And also, sometimes like we feel like it's simple, but it's not. You get angry with your parents, let's say, or you have tantrums, let's say, for sometimes. So you need to, after a while, when you realize, you need to ask that question to yourself: is it something changed? Why I'm getting angry, or why I'm getting agitated, or anxious, or so stressed? Or you can go back and ask this person, like, am I getting angry lately? There is nothing wrong in that. But that way you will find out, or you can assess a little bit of your state of mind, that okay, something is going on, something is wrong. That might be simple, that might be there might be a simple solution to that. It's not like medication. Just a therapy can help. But if you don't do that, then it becomes a monster, and then it becomes difficult to manage.
I just think there's no health without good mental health. So it has to be part of the overall package.
Exactly.
Like, I will not live my best life without having good physical health to the extent possible, and good mental health to the extent possible. So really focusing on that. I have a lot of faith in young people. I feel like the conversations are really happening much more with each generation, and we're going to get there.
Yeah, absolutely. Yeah. This was amazing. Thank you so much for both of
Thank
you
you
being here.
Thank you.
Yeah, that's it for the Unchill Podcast.